So medical assessments and medical care in these technical rescue settings is very critical. And so an element that we've added to the 2021 curriculum update in our GR program, and it will filter through into rope technician, confined space, wilderness SAR, and tower rescue, is the idea of a 60-second trauma assessment. And the premise here is that we want to do a good, quick trauma assessment to identify the critical nature of the incident and to end it with a radio report out that's of high quality so the incident starts on a good note. What I'm going to demonstrate is based on the principle of BATS or BATH, where you have bleeding is the most important, airway is second, tension pneumo is third, and hypothermia or shock, however you want to think of that, is the fourth element that you want to address. So the way we bundled that up is in what we call the 60-second medical assessment. The first thing you're going to do is a blood sweep head to toe. Should take you about 15 seconds to do that. During that blood sweep, we're looking for major bleeding, things that will kill them right now. You can't replace blood, so we want to keep all the blood in their body that we possibly can. If you're on your blood sweep, as you do that and you find minor bleeding, ignore it and just keep going. You'll come back and address that later. Alternatively, if you find major bleeding, the kind of thing that you want to turn off with a tourniquet or you want to pack with a wound packing, dressings, those kind of things, then you'll address that. Otherwise, you keep moving. The second piece will be listening to the lungs on the left side, listening to the lungs on the right side. All we're going to do is listen to that right down the middle of the side here. We just want to know, is it there or is it absent? As we're listening to that lung sounds, we're looking at the airway, making sure that it's there, making that assessment. If it's not, keep going to the next step. We're just going to acknowledge that. And or if we have extra hands there, then we'll make a quick assistance there. The third piece is going to be to check the circulation. We're going to do that radial first and then carotid. If you choose to do these at the same time, that's fine, but the most critical thing we want to know is if they're there in both places. If they're there radial, depending on what book you read, it means that it's probably at least 80 systolic. If it's not, and it's their carotid, then we know that they're hemodynamically unstable, which by most COGs indicates that it's going to be a trauma activation or whatever your nomenclature is for a trauma type patient. That pulse check should take you about 10 seconds. The last element is to take a deep breath. It should take you about 20 seconds. Think about what you're going to say on the radio. Develop a good CAN report, conditions, actions, needs, and report that radio report out. That way everybody knows what conditions you have, what actions you're taking to improve the circumstances, and what do you need from incoming responders to help make the situation better. So what I'm going to do is go through a 60-second assessment here in full speed so you get a chance to see that, and I'll simulate a radio report at the end. All right, first step is blood sweep. All the places I can't see, I'm looking at my gloved hands, looking for blood, reaching underneath the body, looking for blood, underneath the legs, looking for blood. Anywhere I find major bleeding, I stop and put a tourniquet or pack the wound. Any minor bleeding, I just keep moving. Next step, listen lungs left, listen lungs right. Watching the airway, making sure I hear air movement. Go to the right. I hear air moving both sides. I want to know, is it there, is it not? Do I have something absent indicating a tension pneumothorax? Next is a radial pulse and then carotid. I can check both at the same time, making sure I feel it, indicating whether they're hemodynamically stable or not. Once I have those two, I can give a radio report. Take a second to think. It's a push to talk button, not push to think. Rescue group from patient access. I have a 35-year-old male. I'm going to declare a trauma activation for a GCS less than 13. I've got a broken right arm, bleeding from the leg. I'm going to be splinting his right arm, applying some bandages to his leg. I need 2 additional rescuers, a Furno, and patient package equipment to get him out of here. And that's the skill.